The time exactly 9:15. Assalamu alaikum wa rahmatullahi wa barakatuh. A lovely Thursday morning, alhamdulillah. And today marks the 25th day of January 2018. 25th day of January 2018. And of course, it also corresponds with the 7th day of Jamadul Awwal 1439. Now, my name is Zainab Bean and I will be with you until about 12 this afternoon. In between, Mishka Muhammad also joins you for some lovely messages, requests, and also takes your calls, some job offers and more, but definitely informs you as to what's happening in and around your community. That's the second hour. She also will be giving you the latest update in our weekly update with the South African National Zakah Fund, inshallah, around 10:15. So all that and more, you're on radio 786 and 100.4 FM, also 1584 medium wave in Pretoria. Coming up this morning, Dr. Faiez Kirsten takes over on a Thursday, and he will be dealing this morning with one of the things I think that I'll call a silent killer, and that is diabetes. I think every second person that you meet, you'll hear, if it's not the person that has diabetes, it's some relative. So inshallah, we take a look at diabetes this morning, but of course we first recap where we left off in the last discussion. Also the final hour, do stay tuned for that. Sufyan Al-Talib joins me, and we talk education, because education matters on radio 786 and 100.4 FM. Firstly, Assalamu alaikum, Dr. Faiez, and shukran so much for being here.
Wa alaikum salam wa rahmatullahi wa barakatuh, Zainab. How are you today?
Well, alhamdulillah, yourself?
Alhamdulillah, alhamdulillah. You feeling older? After your birthday last?
I said this is the last time I'm celebrating.
Well, as they say, age is just a number, unless you are a cheese, they say.
Oh, Dr. Faiez, we left off last week. We discussed
goal achievement,
yes,
and goal setting.
As it's the beginning of the year. But it's funny how quick time goes, isn't it? Because it's already the 25th today.
Flies by.
So we're almost out of exiting the first
So it'll
month.
be 2019 if we get there.
Inshallah. Now, just recapping last week's discussion, inshallah.
While we discussed goal setting, goal achievement, very important subject. But I wanted to bring up a point that Brother Ismail, who phoned in, mentioned about, before we go on to diabetes. I think this is so important. In fact, I think we must maybe have a separate program just on this specific topic, which is about the House of Saud, or Saudi Arabia, and the role that Saudi Arabia is playing in the globalist agenda. And he mentioned something about the link between the Saudis and Zionism. This is such an important topic. We can't really do justice in a few minutes. But we must understand that the role they're playing, and, we must question whether these people are, what are their belief systems? Because if you look at their behavior in terms of what they are doing, it's obviously contrary to Islam. You'll find that they're bombing Yemen, and they haven't defended the Palestinians with their air force. They haven't come to the rescue of the Palestinians, but they bombed Yemen, into the Stone Age, with causing massive casualties and massive epidemics, cholera epidemic in Yemen. So when you talk about Zionism, the correct word really is Rothschild Zionism. We should look at the history of Zionism. We have to look at the history of Saudi Arabia, who actually formed this country. Ibn Saud and Abdul Wahab, I think his name was, got quite a long name actually. And these people are actually descendants of mixed Arab and Jewish descendancy. Okay, so they're not pure Arabs, and they definitely have Jewish blood in them. And so we need to look at that. It's a very, very important subject, especially people going. And remember, cheap Saudi oil actually funded or fueled the American empire. So it was actually Saudi oil really largely over the last several decades that enabled the American empire to get where it is today. So we must ask ourselves, are we funding our own enslavement when we go to Saudi Arabia and so forth, our own oppression? These are questions we need to ask ourselves. Obviously, we need answers, and I keep asking myself these questions, because you don't want to act against your own best interest. You got to think, and the Quran actually compels you to think. It tells you mustn't be like a sheep, In fact, if you don't think, you're actually below the level of livestock. So this is very important for everybody, not only Muslims, but also everybody in the world, really, because Saudi Arabia plays a massive role in the geopolitical sphere. They play a massive role in the banking sector. So we must actually understand the globalist agenda and the Saudi Arabia's role in that. So we should perhaps have a whole talk on that at some point so that we all get to understand this whole situation, properly. Anyway, that's a dark subject, and the mindset of the House of Saud, is really disturbing when you look at all the research that's been done there. It's very disturbing. So we need to look at that. Obviously, they're in bed with the Rothschilds and with all the other globalists, and so birds of a feather flock together, they say. So we need to look at that. Anyway, let's go on to a better subject. Maybe not better, I don't know. Maybe just as worse, or just as bad, and that is diabetes.
Yeah.
So, yeah.
They say that 3.5 million South Africans, which is about 6% of the population, suffers from diabetes, and there are many more undiagnosed.
Would you say, what was the number?
3.5 million.
We're in South Africa?
Yeah.
Oh, yeah, it could be in South Africa, but across the world, it's almost like 450 million. So that's across the world. And that's just diabetes. Then you have pre-diabetes, which is the stage before diabetes. And then you also have metabolic syndrome. And if you put all these things together, it's a massive disaster. In fact, they're predicting that perhaps in the next 10, 20 years, everybody will have diabetes, which is insane. But that's not surprising, given what's causing diabetes.
Tell me, is it lifestyle that is one of the major contributing factors?
Underlying is diet. Very, very well. First of all, there's type 1 and type 2, and there's type 1.5 also. And you get gestational diabetes, which is diabetes in pregnancy, because of the changes that occur in pregnancy, some hormonal changes and so forth. They get diabetes. But type 1 diabetes is an autoimmune disease, basically. There's cells in the pancreas called beta cells. They produce insulin, which is a hormone. And when you have your body or your immune system attacking these beta cells, they destroy them, so you can't produce insulin. And you need insulin to get sugar from the bloodstream into your cells, into your liver, your muscles, and the cells of your body, your brain, and so forth. And so if you have no insulin, your sugar just rapidly rises in the blood, and that causes massive problems. So that's the type 1, which is an autoimmune disease, and there's many causes for that. Vaccines play a huge role in type 1 diabetes, GMO foods, toxins, and so forth. Anything that can cause an autoimmune disease can cause type 1 diabetes. But the more important one and the more common one actually is type 2 diabetes, which you see around you, like you just mentioned earlier on. But, everybody seems to have diabetes, or if they don't, they know somebody who has.
Yeah, and the strange thing is now you find that you get child diabetes, or children who also has diabetes.
In childhood, this used to be type 1 diabetes, but now they're getting type 2, which used to be a disease of people over the age of 40. An adult onset diabetes. Now you're having children getting type 2 diabetes, which is insane. And that's simply because of the food that they're being fed, basically. And kids are overweight with type 2 diabetes. That is like beyond insanity.
So let's start at the very beginning. What exactly does it mean if you are diabetic?
It means your body's not controlling your blood sugar correctly. Okay. In other words, you mustn't have sugar in your blood. You must, you must have sugar in your blood, but you mustn't have a level that's higher than a certain percentage or a certain concentration. Let me put it that way. When your body can't control the level of sugar in your blood, it keeps spiking, it stays high all the time, you're heading for massive problems. Okay, your blood gets sticky. If you take a bit of a syrupy drink and you put it on a table, what happens? It's sticky, right? So the sugar in the blood starts sticking to everything. It sticks to the hemoglobin in the blood. You get a raised hemoglobin A1C, it's called. It sticks to other proteins. It sticks to cells. And you get what we call advanced glycation end products. And stuff just destroys your body, actually, the sugar. So if it's not in the cells and it's in the blood, then it's causing massive problems.
So what are the causes of having too much sugar in your blood?
So the first thing is diet. If you're eating foods that's causing a spike in your blood sugar every time. So if you're having foods that are what we call high GI, in other words, the food that you eat, the carbohydrates, releases glucose very rapidly into your bloodstream. Then your sugar spikes, and then your insulin needs to be produced in response to that high blood sugar from the pancreas. So your insulin level spikes. And if this happens all the time over a period of months and years, your cells just stop responding to the insulin. So now you can't get sugar from the blood into the cells because the cells, the receptors and the cells just down-regulate. So insulin can't really work anymore.
So foods that are high in GI is?
High GI foods are carbohydrates, refined carbohydrates. Those are the main ones, these processed foods. So any food like white flour, white bread, white rice, foods that are not in their whole form. They've gone to the factory, to the mill, and all the fiber's been taken out. And basically, when you eat those foods, they break down rapidly into sugar, glucose, which rapidly enters the bloodstream. and then you start getting problems. If it keeps spiking all the time, day in and day out, from the foods that you're eating, the incorrect foods, then eventually you end up with a situation where you can't control your blood sugar. It stays high in the blood, and then from there you start getting problems. So it starts with insulin resistance, really. Your cells resist the impact of insulin on them. Yeah.
Now, it is also said that the highest prevalence of diabetes is among the Indian population in South Africa, which is from between 11 and 13%, and as this group has a strong genetic predisposition for diabetes.
There is a small component of genetic component to diabetes. It's largely a lifestyle thing, like I said, the diet. There's toxins also playing a huge role, causing inflammation around the cell membrane, and so your receptors can't really see or hear the hormone insulin. They can't really respond to it, and you start getting problems from that, really. Yeah.
Now, if lifestyle is the major contributing factor, then we need to do something about that. If the number of people who actually suffer from diabetes are increasing all the time.
Yes, a sedentary lifestyle, lack of exercise, like I said, diet is the big one. Toxins in the environment, poor sleeping, hygiene. You're not getting enough good quality sleep. All these factors play a role. Anything that's going to stress your body can actually cause you to develop diabetes. And so, you're quite right, lifestyle is so crucial, but you have to understand how the brain works. The foods also that we eat cause cravings, so people become addicted to these terrible processed foods, these carbohydrates, these high GI carbohydrates. So you actually develop a food addiction, and so you just have to start. You just keep eating all this food all the time just to stay normal.
I'd like to know, can it be reversed if I decide today that I want to eat all the things that are good for me but I already damaged my body, let's say for argument's sake, with certain things that are not good for me. Can it still be? But before you answer, we do have a caller. Let's go. You're live on here. Assalamu alaikum.
Assalamu alaikum, Zainabeen. I just want to be grateful to Arab for this time and space, and also for the person you got there, at the studio. How are you, doctor?
Alhamdulillah, brother. Yourself?
Alhamdulillah. I'm not going to ask Zainabeen how she sounds good. Alhamdulillah. I just want to add to the discussion about diabetes and all this sickness. Doctor, I don't know. I'm sure you're aware of the pharmaceutical companies. I don't know if you noticed that, well, my experience is, I don't say everybody's experience, but my experience is that the doctor never tells you what to avoid. He will tell you to come back. Because if that doesn't work, that pill don't work, we try another pill. But he never tells you what you must not eat, what you must stop eating, and what you mustn't do. And that is my experience. I don't know if other people have that experience. Coming to the sickness of diabetes, there's so many cures for it, but it's not promoted because the mainstream media is not controlled by the people. In fact, some of the people got killed. In fact, there was a guy that invented how to run the car with water, and they killed him because the petrol people wanted to get rid of him. And there's an American guy, and now there's a Japanese company that's doing the same thing, and they're trying desperately for a major company to promote these cars so that people can save money. But I don't think it's going to work. But what I'm trying to say, doctor, like you say, it's all about mind control. And one look at the Davos thing that's happening now. Here is a typical example. Our rand was 14 rand when Zuma was in power, because Zuma checkmate or sort of checked these people that was controlling our economy. He wanted to have an investigation into our reserve bank. All these things was because he was touching on these people's wealth. And so somewhere along the other, it's unfortunate that Zuma, because of his attitude and his lifestyle, that made him what he is today. But what I'm trying to say is the control of our economy, the control of everything. Like you mentioned about the Zionists, about the Arabs, about the Saudi government, it's all about control. That's why they're very scared for this. For Iran. Because Iran doesn't, that Iran will contradict them in such a way that people will come to realize that all the years they have been falsely indoctrinated, and this is unfortunate. But what I'm trying to say, doctor, it is all about control, social control. If you look at this Davos thing also, that is just a talk shop. They're going to talk. It's all about from the top getting richer and the bottom must be exploited. I mean, Namabeki and them undertook the GEAR program. Instead of he's sticking to the RDP program where everybody's going to get houses and whatever, they changed it to the GEAR program, and it was all about investments. That's how these boys became rich, Cyril Ramaphosa and them. They became rich. Now it's payback time, you see. He's there now. He's there in Davos now because they are going to dictate to him what they want in this country. And this is exactly what's going to happen now, Doctor. But I hope that, you asked for Zainabin to bring up this, to have a special program on the Saudi government. And I just hope that people don't get angry at the scholars that taught them wrongly, because it wasn't their fault. They were taught by these people. Shukran, Doctor.
Shukran so much. Wa alaikum salam wa rahmatullahi wa barakatuh.
Well, shukran for that, Brother Ismail. I must commend you. Brother Ismail is a brilliant analyst. He's always hitting the nail on the head. Well done with all your research there. Is absolutely correct. I mean, everything is said and everything has been saying, is correct, actually. The first thing you mentioned about doctors, a doctor... Actually, an anonymous person said a doctor who doesn't know anything about nutrition is like an accountant who doesn't know anything about maths. They're both very dangerous to their clients. So, and most doctors know nothing about nutrition, and basically diabetes is a disease largely of poor nutrition, but many other factors also. So, if your doctor doesn't know anything about nutrition and he's treating your diabetes, I mean... that was going to tell you a lot. Coming back to Davos, I mean, that's such an important point. I mean, Davos is a deception, basically. I was just driving down the road towards to come to the studio this morning, and I saw a headline saying, Davos charm spurns the rand. And underneath that banner there on the road was sitting a whole lot of guys looking for work. They're waiting for someone to come and give them work. And every year, these guys meet at Davos Economic Forum, whatever they call it, fooling everybody that they're trying to make the world a better place when in fact the world is getting worse economically. Okay, so Davos is a deception. Everybody that goes there has to be part of the globalist agenda. You can't go there and say I'm anti-globalist. I'm anti-globalist agenda. If I had to go there, they'll probably lock me up. Obviously, I wouldn't be invited in the first place. But Davos is a deception. We mustn't be fooled by what these people are doing. If you understand the mindset of the people attending Davos, that's what you need to understand, is the mindset of the people attending Davos. And simply, like I said, under that poster, this newspaper poster saying Davos charm spurns rand, you have all these people sitting there without any work. So how effective are these people at Davos? What are they doing? So we must be very careful of deception, which Quran tells you all the time. Do not be deceived by the great deceiver. Anyway.
Yes, back to diabetes this morning.
Yes.
One of the questions that came through is, what are the symptoms of diabetes? Because according to what I've read, it takes on average 7 years for a person to get diagnosed with diabetes for the first time.
Yes, you can have pre-diabetes for many years and you don't even know it, unless your doctor does some blood tests, then you'll realize you got diabetes. But oftentimes symptoms occur, okay? Like you'll feel very thirsty, you'll feel tired, you'll feel sometimes your vision will be blurred, because the high sugar in the blood actually causes blurred vision. You may start getting tingling in your fingers, skin rashes. A whole range of symptoms can occur with diabetes because your body's out of balance now, and there's a lot of sugar floating around in the bloodstream, and so you get these range of different symptoms. But the symptoms are what the doctors start to treat. They don't treat the cause. And so you'll find they put you on medication, which causes more problems. They found that these medications cause more problems. They cause loss of nutrients, like metformin will cause loss of B12. And then that's going to put you on a road to even more problems, as you are treated by a doctor over the next few years. And you end up losing your leg, losing your vision, and thanks to the doctor who's put you on medication, which actually didn't help you at all, actually made your problem worse.
Sure. We have a caller on the line, Dr. Faiez. You're live on the Assalamu Alaikum.
Wa alaikum salam. I want to ask the doctor a question, seeing he can answer lots of questions.
Yeah, not only a few.
I want to know from you, you always answer the Ahmadis on the phone. how well do you know the Ahmadis clan? Because there's only a few of them, and they always pose a question against the ulama, against the teachers of Islam.
Brother, this is not
they
the
are
topic.
Forces of the kufr forces. They are.
Shukran, brother. I don't think we are discussing the Ahmadis or whoever's kuffar. So please do stick to the topic. It's diabetes that we are talking about. So I would really appreciate it if you could stick to the topic. We're not discussing any form of Ahmadis or whatever the caller was saying. So diabetes is a topic. And coming back to the symptoms, brother, Dr. Faiez, we said that there are about around 7 years before a person gets diagnosed with diabetes for the first time. And it said that sadly the result is that about 30% of people with type 2 diabetes have already developed complications by the time they are diagnosed, which is very sad.
Just to answer that call, I mean, I don't really know the belief systems of people phoning in. So I'm just answering based on my research, my understanding of how the world works. And if anybody has a problem with them, I keep inviting people and say, look, if you have a problem with what I'm saying, you're welcome to contact me and we can discuss it. One person has done that, but I didn't pursue that because obviously I could see some kind of problem there. But most people don't respond to what I say. I mean, if you have a problem, you're welcome to contact me off air. We can have a nice discussion, you know. I just speak about what I have researched and what I've come to know as facts, okay? I don't beat around about the bush as people can hear. I mean, if these are the facts, these are the facts. What can I do, you know? And this is the reality as a doctor. This is what I see. I need to ask what's causing these things. There's a global health crisis. I've researched this extensively. What's causing it? There's a banking crisis, a financial crisis, economic crisis. Where's these crises coming from? It's your duty as a Muslim to find out the causes. If you skirt around the truth and you deny the truth, you actually deny Quran because you're saying the Quran doesn't. Those instructions in the Quran are basically not what I'm going to follow.
And you will be accountable for those.
You will be accountable for it. So I'm not here for a popularity contest. I'm here. My goal is,
inform.
At the end of this life, you're going to go somewhere, okay? I want to go in one direction. I don't want to go in the other direction, okay? And I don't care if people kill me or they hate me. It doesn't matter to me, what happens on this earth. What happens to me is, what I'm concerned about is whether Allah is pleased with me or not. If Allah is pleased with me, that's all I'm interested in, you know? The facts are the facts. Anybody who has a problem with what I'm saying, please contact me and we have a nice discussion. I will show you all the facts. If you are sitting with misfacts, misinformation, I will show you the facts. But anyway, let me not go over a tangent. Let's get back to diabetes. What was your question, Zena?
Symptoms and the fact that it's sad that the result is that about 30% of people with type 2 diabetes have already developed complications when they are actually being diagnosed.
Yes. Complications are huge problem. People don't die from diabetes. They die from the complications of diabetes. So people start getting gangrene, vascular disease, amputations start happening, people start going blind, develop all the hypertension and so forth. Type 3 diabetes is actually, they're calling Alzheimer's type 3 diabetes because what happened there is you get insulin resistance in the brain. So insulin can't push sugar into the neurons of your brain and you start getting Alzheimer's. So they're referring to Alzheimer's as type 3 diabetes, okay? So when your sugar's out of balance and not well controlled, you're putting yourself on a road to disaster,
Sure.
Yeah.
But now, I'm thinking that in order for someone to at least detect diabetes earlier than before it actually develops any complications, what are they supposed to look out for? What are the signs?
You must have a high level of awareness regarding health and wellness. That's the first thing. That's why I keep saying you must raise your level of consciousness, because if you're not thinking about these things every day, your health, your wellness, you're just going along eating what everybody else is eating, you're not exercising, and you're thinking this is all normal, subconsciously assuming this is fine, this is the way life is, then you're on a road to disaster because you could be developing diabetes or some other disease, cancer, whatever. And so you need to be aware of your health and wellness and then go for regular checkups, And that's why I set up this institute, because you can't see a patient for 15 minutes and expect to help the patient. And that's why the institute is a membership-based institute, so I can see the patients on a regular basis. They pay a monthly fee, and we see them virtually every week, basically. I mean, follow them up. And we also start, there's programs that they can do, educational programs, because without education, you're sitting with a disaster. In fact, they say a little knowledge is a dangerous thing. But I say no knowledge is a disastrous thing. What is worse, danger or disaster? When you have no health, that's a disaster, basically.
It is 22:10 on Radio 786, and we're talking about diabetes this morning. Dr. Faiez Kirsten joins me in studio, and you're more than welcome to participate. Send your comments, questions to 0786 1011 12, or why not call us on 021 699 1786. We'll take that short break, and after the break, we continue. Stay with us. The time, almost 9:45 on Radio 786, and we're talking diabetes, and Dr. Faiez Kirsten joins me live in studio to discuss this further. We've dealt with some of these signs and symptoms, but also what daily diabetes is, and also the different types of diabetes that that one gets. Now, globally, 366 million people have diabetes, and the International Diabetes Federation, the IDF, predicts this number to rise to 552 million by 2030. Now, Dr. Faiez, before we comment on that, we do have a caller holding. You live on here. Assalamu alaikum.
Salam to you, lady, and salam to the learned doctors.
Wa alaikum salam.
I certainly appreciate what this gentleman is doing to make us more aware, not only in the medical field, but practically every aspect of life, how we're being dominated by a certain force. But as a Muslim, I want to pose this question, and I posed numerous times, and I don't find a satisfactory answer. You know, so we know what is facing us. As Muslims, we were sent, Nabi Sallallahu was sent to make life better for the human being. And we know the onslaught of the serpents. But we keep on lamenting and discussing this thing. Who is to take the initiative and try to at least bring some relief to the masses or whatever? You know, even our so-called Muslim governments, they cause havoc for their own citizenry. And we discussed the shukran for this. But can you please tell me, is there a group of people should be formed to try at least discuss this issue that can come to that at least some way out to counter these kinds of things? And I don't find nobody speaking in this direction. It's good, we make salah, we give zakah, we fast, and what have you. But for instance, we're facing a drought now, and in many areas in Africa, similar things is happening to the human beings. And Allah gives us solutions to this. But we address our think tanks. We get like the waterfalls, water is in abundance, and our engineers can't, if they can formulate a pipeline from Alaska to Iran, what? Can't they make a water pipelines to these people to alleviate? And this is the kind of thing. Islam is not only consisting of salah and puas and what have you. The whole thing is being formulated against us. And nobody, I surely hope there will be a group of people to discuss these kinds of issues. I'm hardly a learned person, how they can at least try and give the people understand the general message in the massages, our learned people. At least we're suffering now, the people in young men die, 21 years old. They're going to wait how many days for him? They're going to see what's the reason why he died. And there's no Muslims that's going in that direction, or with some encouragement for our younger people. You should go in that direction, because if you don't do it, you find other people cutting you to ribbons because we are asleep. And behold, even as I pose this question again, when are we going to awake and start discussing these kind of questions?
Shukran. Wa alaikum salam wa rahmatullahi wa barakatuh. Dr. Faiez, we also have really a number of WhatsApp messages that I would like to at least
I was going to say shukran to the brother for that. Some very, very important points he brought up there. Always brings them up, and we must address that. We can talk about that, yes.
Inshallah. Now, we have a question that says, my husband's arm always gets stiff, and when I give him a discipline, it helps, but am I doing the right thing? His health is very good and not on any meds.
Husband's arm always gets
stiff,
and she gives him discipline for that.
Yeah. And it seems to work.
Okay, well, I would first try and find the cause. What's causing the stiffness of the arm? Because I wouldn't just give Disprin for that, because Disprin has its risks also. So I'm not sure what. You must try and first find the cause. What's causing this? It should just be a muscular problem rather than a vascular or a blood problem or whatever. Yeah.
Now, this is it's basically the question that I asked earlier before we went for the break. It says, "Shukran so much for the informative program. I'm looking forward to the doctor's reply. After having a very bad diet, can a good diet rebuild your body?"
100% it can. You can reverse type 2 diabetes, and you can even start reversing type 1 diabetes with stem cell therapy today. It's possible to reverse type 1 diabetes, which they thought was impossible years ago. But certainly type 2 diabetes, unless you're so far gone and there's no hope for you. But in most cases, you can reverse type 2 diabetes. And that's basically what I'm involved in, is in reversing disease and preventing disease. Yeah.
And then can Doctor please explain what happens when the body goes into DKA?
Diabetic ketoacidosis, yeah, that's a whole story. Usually type 1 diabetics go into diabetic ketoacidosis. It's a whole metabolic disturbance that happens because you're not producing enough insulin from your pancreas, or no insulin in most cases. Yeah.
Let's take the caller. You're live on here. Assalamu alaikum. You're live. Wa alaikum salam.
Alaikum salam.
I just want to ask the doctor a question.
Go ahead.
The thing is this, I've been to my doctor, and just lately he tells me I have got sugar. So my sugar was just about 8. And I've been yesterday, and she tells me it's 11, and I'm very, very thin person. I'm not fat, nothing. But now I am taking metformin. Now, as I heard now, the medication is not really good. So I just want to know more about it. Because I am a very fit person, but just lately I've been sort of suffering with my legs, joint pains very bad.
Okay.
So I'll be hearing on the radio. Jazakallah.
Okay, shukran. Wa alaikum salam wa rahmatullah.
She's on metformin.
Yeah.
She wants to know about?
She wants to know whether or not, because Dr. Faiez earlier mentioned that the meds that you're actually getting is not basically...
They control the sugar to a degree, but they have side effects also, and they don't address the root cause of the problem.
So she wants to know, what is she to do?
Well, I'm not a drug advocate. I don't advocate taking pharmaceutical drugs, okay? So I'm the wrong person to ask about pharmaceutical drugs. I used to prescribe them by the ton, in the dark ages. I don't do that unless it's an emergency. You can treat diabetes without any drugs. In fact, you should be doing that. You shouldn't be using any drugs at all to treat diabetes. And if you are, if you are on drugs for diabetes, then unfortunately, you're on the wrong road, basically. There's some drugs that actually can cause diabetes, like the statins, for cholesterol problems. They can actually give you diabetes. So if you have a cholesterol problem, doctor puts you on a statin, you will probably, getting diabetes not too long thereafter, actually. So we need to look at these things. Drugs cause more problems than what they help, and we must ask. We've discussed the pharmaceutical industry and the motivation behind them, just pushing drugs down everybody's throats, basically.
9 minutes to 10 on Radio 786, and we're talking diabetes this morning, and we're answering some of the questions that came via 0786 1011 12. One of it reads, Assalamu alaikum, is diabetes and hypertension related? My husband was diagnosed with hypertension with all the signs of a heart attack. Every day the doc just puts him on heart pills, and he's up to 4 heart pills a day. Please help.
Yeah, this polypharmacy thing is a huge problem. There's metabolic syndrome, where you have certain risk factors that put you at risk for heart disease, strokes, and so forth, and diabetes. And that's if you're overweight, you have a big belly size, you have high triglyceride level, high blood pressure. There's 5 different factors. They all come together to put you at risk for having a stroke or a heart attack, basically. So you got to be aware of metabolic syndrome. If you're overweight, start working on it from today, because that's not taking you to a very good place, actually. You must come down to your ideal body weight. Very, very important.
And then we have one question. Assalamu alaikum. Why is it so difficult to lose weight after the age of 50 or when you're menopausal? Also, how does one prevent diabetes?
It's a lifestyle, eating proper foods, the right foods, the right amounts, taking supplements. Usually it's a plant-based diet that really works well, to prevent all disease, really, if you're eating, a plant-based diet with minimal animal meat, animal products, So that'll prevent most diseases, if not all diseases, really. and if your lifestyle is right, in other words, you're exercising, you're sleeping well, and so forth, you're not taking drugs of abuse and all of these things. So you can prevent disease. It's a very real possibility, but we don't do that as doctors because we're not trained to do that. We're just trained to treat symptoms to manage to maintain disease. So we basically as doctors actually been contributing massively to this global health crisis. Most cases out of ignorance. We don't really know what we're doing as doctors because we think what we're doing is actually correct because we were trained that way. And then obviously when we trained at a educational institution, that's the best training we ever got, But if you look around you can see it's a disaster. Our training has actually been a disaster for humanity. So we need to re-look at what we've done as doctors and start doing things in a different way.
So the question regarding whether diabetes and hypertension is related, and the one that asked the question about my husband that was diagnosed with hypertension and he's been given heart tablets and is now 4 a day. She replies and says that not overweight at all.
No, a percentage of people will be a normal weight, but you can still have diabetes, you can have heart disease, But 80% of overweight people are at risk of diabetes, but normal weight people can also get diabetes because it's related to diet, it's also related to stress, toxin exposure, and so forth. So all of these things come together can give you diabetes.
Can diabetes be reversed if on insulin?
First of all, if you are type 2 diabetic, you should never go on to insulin. Some type 2 diabetics, when medication doesn't work anymore, the doctor says, okay, let's put you on insulin. That's a disaster because that will kill you very quickly. Okay, no type 2 diabetic should be on insulin. Okay. Type 1 diabetics obviously on insulin, but they can become type 2 diabetics also because they can develop insulin resistance. So that insulin that they've been given, exogenous insulin, can actually, your cells can become resistant to that insulin also. So diabetes is a whole disastrous situation. It's a disaster. And the best treatment is prevention, okay? And if you have it now, if you already unfortunately have it, then the best thing you can do for yourself is reverse it. Do everything that you can, and there's brilliant things that you can do which will reverse it in a very short period of time also. But if you're going to be on medication and just treat your symptoms, and your doctor's maintaining your disease, then it's very high likelihood that you're going to develop a complication, and then your life is going to just go down, spiral downwards, basically. Yeah.
Okay, so I just want to know, my blood levels are under control, and my cholesterol but I don't have diabetes. Can I use Herbix to lose weight?
I know about Herbix, and I don't really know the whole mechanism involved. It's something you can buy over the counter. I see it, in these retail stores. It's probably an appetite suppressant, a natural appetite suppressant, I would imagine. The best way to lose weight is actually to change your diet and lifestyle, and not depend on supplements. You must take supplements, but you must take the right supplements. But if you're trying to lose weight using an appetite suppressant, which is either synthetic or natural, don't do that. Rather just reprogram your mind, change your belief system, okay, and then change your diet, lifestyle, and the environment you're living in, if you can.
And then we have another message saying, "Shukran so much for the program. I really enjoy it. I have terrible leg cramps. Can you maybe advise?"
Again, we must find the cause. What's causing? Is it a magnesium deficiency? Is it a circulatory problem? We need to find out what's actually causing it so that we can get rid of the cause, and then the cramps will go away.
But just like with the last few minutes we do have left, Dr. Faiez, what advice would you like to leave with the listeners in terms of prevention, but also the importance of how we live our lives?
We must, first of all, there's couple of steps that you can do to basically treat your diabetes. You must remove certain foods that you're already eating. Most people are eating terrible food, okay? Processed foods, refined sugars, gluten-containing grains, they're drinking cow's milk, which only the baby calf really should be drinking. And then you must put in good foods, take in good foods, eat good foods, high fiber foods and so forth. Take the proper supplements, chromium, cinnamon, fish oil. These things are all really good for diabetes. Follow a good eating plan, like I said, and then exercise. So it's a whole program if you want to really reverse diabetes, prevent diabetes, or basically just be healthy and well. I think before we end, are we ending now, Zaina?
Yes, we will be ending shortly, inshallah.
I just wanted to just come back to what the one brother that phoned in spoke about, a certain mindset of people that keep phoning in. And I said I don't really... I'm not concerned with anybody's belief system who phones in. I'm just concerned about what they say and about the truth, basically. Okay, so the Prophet ﷺ said, when he was prophesying one of the signs of the last age. He said, I fear for my people only leaders who will lead men astray. Okay? And the Quran says, and incline not towards those who do wrong, lest the fire should touch you, and you have no protectors other than Allah, nor would you be helped. And that comes from the Quran, okay, not from me. So people need to take heed of what the Quran is saying, not what I'm saying, okay, and take it from there. But if they have a problem with what I'm saying, of course you can't agree with everything I'm saying. And if you do want to discuss it, then let's sit down and discuss it. If you have facts that I'm not aware of, I'm really happy to learn from you. I mean, really, that's really what I'm here for, is to learn, okay? Please bring those facts to me and we can talk about them. Shukran, Zainab.
Dr. Faiez, shukran to you for your time and for discussing a very important topic, being diabetes. As we mentioned, the amount of people who are diagnosed with diabetes, and that is without those that we're not counting that's not being diagnosed. So we make dua that we can really take heed from the message this morning, but also to change our lifestyle. I'm unfortunately not able to take the last caller, but inshallah next week same time, do join Dr. Faiez Kirsten in studio with me once again between 9 and 10 on a Thursday on Radio 786 and 100.4 FM.